Welcome to Washington. I'm Brett Baer. The effort to make sure all Americans are covered by health insurance could end up costing millions of workers their jobs. That's the finding of a new study on the current plans offered by congressional Democrats and the president. But is it a fair conclusion? We report, you decide. Here's correspondent Shannon Bream.
Healthcare reform is not going to be free.
In a study commissioned by the Heritage Foundation, economist Mark Wilson puts a price tag on the legislative proposals as they now exist on Capitol Hill, and the news is not good for America's employers. Under the Play or Pay mandate, which would require them to offer health insurance to their employees or pay a tax to the federal government, the study shows the mandates will cost employers at least $49 billion a year, putting 5.2 million workers at risk of unemployment or drastically reduced work hours. Another 10.2 million employees will face stunted wages and the loss of their benefits as employers try to find ways to fund the mandates.
This will be a difficult decision for them to make, and they're also going to have to decide to the extent they can raise prices and pass the cost on to consumers.
But reform supporters say under the current system, every day thousands are already losing their health insurance coverage or jobs because of the enormous costs employers are bearing.
What we need to think about in health reform is how to make the system more efficient, how to make sure that the system is protecting jobs, and that's exactly what health reform will do.
Today, Deputy White House Press Secretary Bill Burton took that a step further, saying without reform, the entire U.S. economy faces ruin.
If we don't do something, not only is healthcare going to be in crisis, but the deficit we just will not be on a fiscally sustainable path as it relates to the deficit.
As the financial realities of reform are coming together, there are questions about why tort reform isn't part of the package. One attendee at a town hall this week with Democratic Congressman Jim Moran demanded to know why the threat of medical lawsuits couldn't be reduced.
There's $200 million over 10 years in savings if we had tort reform, and nobody loses but the lawyers. Why have we not even considered that?
Moran turned the mic over to reform proponent, physician, and former Democratic National Committee Chairman Howard Dean, who gave a surprisingly frank answer.
Here's why tort reform is not in the bill. When you go to pass a really enormous bill like that, the more stuff you put in it, the more enemies you make, right? And the reason that tort reform is not in the bill is because the people who wrote it did not want to take on the trial lawyers in addition to everybody else they were taking around. And that is the plain and simple truth.
The president of the American Medical Association says without more protections for doctors in the courtroom, they will continue to order tests that may be unnecessary and drive up health care costs simply in an effort to try to protect themselves. Brett.